Hello everyone, this is Jill with Om Shanti Healing. This is part 2 of our tennis ball therapy. So previously I had done a video on the posterior side of the body. So check that one out to touch onto glutes, hamstrings, and calves for pain relief and relaxing tight, achy areas of the body. This video we're going to work on anterior side of the lower body. So we're going to be working around the pelvic area, working into the iliacus and the psoas. Then we're going to move down into the quadriceps, get the origin points for those long, tight anterior thigh, leg muscles. And then we're going to move our way down into the anterior lower leg. We also will be touching on the TFL and the ITT band and getting into some of the adductor muscles of the inner thighs. So to begin, just to give you visualization, I learned very well by seeing and doing. So to show you here, this is the iliacus area. So right here you see this muscle right through here that runs along the inside edge of the pelvic bone. As you can see, this is the iliacus. So we're gonna place the tennis ball right through here and make our way downward toward the groin. The psoas is right here, and it comes more medial straight down, and that inserts into the upper femur bone. Okay, so we're gonna touch upon those first, and then we will work downward into the thigh. So as you can read here, there are a lot of quadricep muscles in the leg. We're going to run through the most pronounced superficial ones. So we're going to come in from this spot here, and we're working downward from where the hip is, below the hip, and we're going to work diagonal into these adductors here. Okay, and we're going to incorporate some very subtle leg movements to engage the muscles so we can get some activation and release there. Then as we move down, as you can see here, just to back up a second, this muscle here is a really sore one. It's really sore for a lot of folks. This is our longest muscle in the whole body. It's called the sartorius, and as you can follow it, it runs all the way down and inserts down right below the knee. So right in this spot, we're going to work here where we see the vastus medialis and the sartorius kind of joining together. That is a tender spot for a lot of folks as well. So we're going to work through that area, and I'll show you here on the anterior lower leg and what that's going to look like for us. We all can identify where our tibia is, this bone here. Okay, so we're going to work this muscle here right along the edge of the bone, and we're going to give that some relief and some help. That's the tibialis anterior, or in yoga anterior tib or ant-tib. We're going to run down this one. Okay, right here we see peroneus longus right alongside that tibialis anterior. We're going to get right in there too and run down. Okay, from here we're going to, as you can see, this muscle comes all the way down into the foot here. So this extensor digitorum longus, we're going to touch upon that as we run down, and we'll run over that spot too. Okay, so here's just a side view of where you can see these muscles from the inside and of the lower leg. Okay, so just take a peek there so you have a visualization of what muscles we're going to be working on. It'll help guide the ball for you so you have a better idea of where it's going, what way the muscle is going, and you'll be able to feel it a little bit better if you know where it is. Okay, so let's begin we don't have any props besides our lovely tennis ball here and a floor. I like to work on my thinner chakra rug here over my Pergo floor because it gives me some good grounding and I get better pressure that way than if I were to do it on a rug. So just keep that in mind to try to find a hard surface, or at least, you know, a hard surface with your yoga mat. That would be fine too. So let's begin in the pelvic area. So as you can see here, we're going to start in the outer hip here, and we feel the edge of the pelvic bone. So we find that first, and we're going to plant right there. And then we're going to just ride along the ridge and come down at a diagonal line towards the pubis. Okay, so we're going to do, I'm just working one side to avoid being here for a long time. So I will do one side. When you do the video, pause it so you have time to do the other side. You may be here for an hour or more. After we work the anterior leg, we are going to move more laterally. Okay, so just to give you an idea of what that looks like. As we come up onto the side of the leg, this is our TFL right here, tensor fascia latae, acronym TFL. So this is a tendony spot. We're going to dive in right underneath the crest of the iliacus. So we're going to be right about in here, okay, this area here. And then we're going to lift up and over the trochanter here of the hip bone. And we're going to plant right here into the TFL, and then we're going to run down from there. As we do this, you're going to touch upon the vastus lateralis a little bit. Right? That's behind the TFL. So you can see you get a little anterior and little lateral here along both sides of that ITT. Okay? Let's give you a visualization there of what that looks like. Okay? And the adductors, as I had brought up before, these are a few of the adductors here. So as you can see, these smaller muscles that run along, and we're going to touch on these right after we get the psoas in that iliacus spot. We're going to move from here down and get into these adductors. And the adductors provide us with pulling the thighs together. So if you're a biker, or if you're a runner, or if you sit at a desk all day and you don't move your lower body very much, you're going to have a lot of short, tight muscles in this area. So we'll work those out. They might be very sensitive, but we'll take our time and I'll show you ways where we can decrease pressure, increase pressure, and so on and so forth. So we're down on our belly. We're going to take the ball right above the pelvic bone, and we're finding that little groove, holding the ball there, setting yourself up, and rolling to the stomach. So we can be up on our elbows here. Let's curl the toes of the leg we're working on. Now, you feel where the ball is pushing into your body, right? We know where the pressure is. So when we activate the muscles we're targeting with this work, let's focus on where the pressure is and focus on contraction under the pressure where we're feeling it. Okay? So our toes are curled, and we're going to lift the knee and press out through the heel and focus on pushing that iliacus to the floor. So we'll feel it kind of pop out at us, and it may be very sore. Okay, so we're going to just soften the leg, bring the knee back down, try to release from pressure, from contraction, relax totally, and then we're pressing out through the heel again and push the muscle into the ball. Very effective there. I'm feeling quite a bit, and we're lowering down, finding release, and then let's press out again. Lift the knee, press out. Good. And lower down. So as we make our way more medially to the groin, we're going to activate that psoas here in just a little bit. So we do a few of these, we find relaxation, we allow the foot to rest for a second, and then just move your hand, slide that ball a little bit more down, find that spot, and roll back onto your belly. And then we're doing the same movement. Press out, push the muscle down into the ball. Yeah, that is working. And then relax the leg, completely let it go. Okay, so you may feel a lot of tight sensations here. You may feel a lot of fieriness here. Simply because if you get massage, you may work with a therapist that have never, you've never had your abs touched. You may never have had your pelvic area released. We hold so much tension, so much emotion, so much stuff going on there around our reproductive energy source, around our mobility of getting our body around, utilizing our legs, all of our life experiences. I mean, you can hold a whole lot of emotional stuff in the hips, in the pelvis, which will inevitably create misalignment, discomfort, pain. So if you do have a therapist you work with, I would ask for that. I provide that service. I work deep into the abdominals and provide a lot of relief. If you have low back pain, you gotta work the abdominals if you have chronic low back stuff. Okay, let's relax the leg and come back down. Okay, so we're moving a little bit more down, right above that pubic bone here. Find the edge and sink back into it. Same movement here. We push out through the heel, press downward into the ball. Good. So we're right in the crease of the pubis and the inside of that thigh, right near the groin. So we're right in that groove there. And we're releasing a whole lot of tension from that spot. Press out through the heel, press downward into the ball. And then we come back down. Each time here, since this is such a hypersensitive area, in between a couple reps, just make sure you give yourself that moment for the muscle to reset, let go completely, and then carry on. Okay, so we worked into that iliacus. We touched upon the psoas, which is right about here. Let's get a little deeper into the psoas before we move into the upper leg. So here's my hip bone. So I'm coming down about here at a diagonal. So think about the top of your hip bone, go in till you get the groove where you sink in, and then go down about an inch. So I'm right about here. This is about where I feel my psoas. We're holding it right there, and we're pressing back down into the ground. Okay, same movement. We press out through the heel, engage, push down. Wow. And then lower that leg back down. Find release. Try it again. Reach out, push downward into the ball, and release. Okay. So in doing this work, you will feel so much better around your hips. You will feel a huge release in your pelvic area, where you otherwise may feel a lot of restriction there in mobility and things of that nature. So moving down from the psoas, we're going to get into the leg. So here's my trochanter here. So this is the bony nub that comes out from my hip bone. Okay, we want to go right in from that spot and start very laterally right about here. Okay, so we go from the trochanter, come right from that spot, and come in. Okay, so I'm going to hold the ball there so I can sink back down. Same movement. So we're very lateral with this one. This one's going to get into that sartorius. So let's hold the ball until we can get more medial, where it'll just hold it in place. So you see how it's very easily going to just slide out from underneath me. You can hold it, or another option is just to sink over into the weight into that leg and see if you can just use downward pressure with your body to hold it in place. Okay, same movement. We're curling the toes. and we're going to press out. So focus pressure under the ball and push the muscle into it. Nice. Now let's hold the heel at extension and make some tiny inward, outward rotation of the hip. So again with this one, utilizing a few of the movements, taking those few movements, trying a different one with the rotation, with the extension of the heel, pressing down. But in between every couple ones, take that moment, kind of decrease pressure by just elevating your hip a little bit towards the ceiling and then pressing back down. Okay, so staying here for as long as you need to. We feel this as we push down. I feel this all the way down my lateral thigh. So you may feel that same sensation here. So let's just roll. We feel we got good pressure. So I'm not going to lift up and off of the ball right now. I'm just going to roll a little to my right and guide that ball downward. Pressing out again. Lowering the leg to relax. Try to release and soften the muscle there before you go back in for another one. Press out, rock it. So press back through the heel, rocking forward and back. Rocking by turning the hip left and right. Okay. Just going to explore and feel what works for you. Okay. So we're going to get more into the adductors now. So with the adductors, we're going to open up the hip laterally. So we're getting right in here in this area. So what we need to do is we need to turn the hip out. So we're going to come down onto the belly, and this leg's coming forward. So we can tuck the ball right underneath us. Okay? So let this knee slide out so you can get as close to the ground as you can. We're applying that pressure right inside the thigh. So we're right about here, okay, as we turn the hip out and we lie down. Okay. So with this one, we want to settle in there, find the downward pressure. Okay. So with this one, you can try to straighten the leg, see how that feels, and bring it back in. You can work from the back of the hip here and ground, pushing down into the ball. Find a little rocking, back and forth, forward and back. This is more, as we rock forward and back, this is more cross fiber in the muscle. Try some small circles and just kind of explore till you feel it letting go. The idea here is where we find the sore spots, we work them with this pressure until we find the release in the muscle where it melts away and you find total comfort in the area. So we're just going to continue to work here. So we can get, these are smaller, so we can, with the, where we have the ball planted here, we can get those 4 we were talking about at the beginning. So we're just going to work here. Again, stretch the leg out, see how that feels. You might be able to find you can get better pressure that way with the leg extended as you can push down. So try that and see if it works for you. Okay. When we're done here, we're going to lift up and take the ball out. So let's work the lateral thigh. Okay, so we're going to start in that TFL. I'm going to switch sides. Okay. So I'm going to lay down, up on my elbow. We're very lateral. This top leg is going to come forward to help move the body this way and this way. Or we can use this foot to lift us off of the pressure if it's too intense. Okay? So as you saw in the book, this muscle is shorter and it's tendony. So we want to be very cautious if we don't want to move too quickly. We want to be very mindful in this area to take it very slowly. Okay? Once you plant it, you may feel some referral sensations into your glutes. You may feel some referral pain down your leg. That's just a good indication that you're right on top of it. So here, we rock forward and we rock back. And all the while here, let's try to just stay as relaxed as we can in this super hypersensitive spot. We just do our best. Rock forward. Remember our rooting through our yoga arms as we balance here. And rock back. Good. And then let's try some lateral movements. So we're shifting forward and we're shifting back. Just very subtle movements is all you need. Shift forward and shift back. Good. Now let's try to straighten out this bottom leg. Stretch, pointy toes in reach, and let's take this leg off the floor and see how we do there. Yeah, and back down. That could be really intense. Lift the leg up and back down. Okay, one more time. Lift the leg up and back down. Now let's release out of the muscle and let it relax. Give it a second. You'll feel it. Take a second and then it just will soften for you. That's the ideal scenario, of course. Good. So moving on, we're getting into the ITT. So here's my trochanter. Okay. And we're going just below that, right into this ITT, okay? So back on the side. And again, guys, this can be really, really super intense. So if all the way on the side is just way too much for you, you can simply put the foot in front, push up, and decrease pressure, okay? So we're starting at the top. And let's go down just a few inches so we can just desensitize and then come back up. And we don't want to go too far because we don't want to ruin the alignment in our shoulder while we're here, right? Good. So after we run through that, we can certainly lift this leg up and back down. Good. We could bend the knee, see how that feels. We come down, we move the ball just a few inches, so we're just above mid-thigh. We come back into placement, okay? And we rock just a few inches at a time. This is going to be really a super sensitive spot for a lot of us, all of us pretty much. Rock, rock. Ooh, yeah. That's tender. So let's come down and go to about here, okay? And then we're rolling over again. So if you fatigue in your elbows, if you can comfortably twist your body enough to get both arms down on the floor, then certainly utilize both arms for support. And then you can more like bend the knee and rock it this way. You could bend the knee a little bit and you see how I am doing more cross the tendon perpendicular wise. I'm no longer with the tissue, but I'm going crossways back and forth. So try that too. See how that feels for you. That is pretty good. Okay. Good. So moving on, I promised you some of those adductors. We're going to get right here. So prepare yourself for this one. This one's going to be super, super fun. Okay, so we feel the side of the knee there. We want to ride up until we get into the groove right there. Okay, so for this one, we're going to be on the inside of the leg. Okay, and that leg is going to be down on the ground like this. Okay. So you'll feel it once you get in there. It'll feel kind of electric, kind of fiery. We'll plant it right there. Okay? So the weight of your leg here will most likely be just plenty of pressure in this spot. Okay? So what we're going to do is we're going to push down into the ball. Okay? So I don't want you to strain from your knee to push down into the ball. Let's work more from the hip and push down. That will give you more stability, more power. And then let's lift the foot off of the ground, and we're slowly straightening the leg. Good, and then come back to a bend. With the pressure here, you may find that you can't straighten your leg all the way. So you just go to where you can with it. Stretch out. And back in. Good. So you will feel it moving underneath you. Good. Now let's bend the knee and put the heel down on the ground. So we're relaxing. We can lift up. Let the muscles soften. Come back down. Okay? So we're going to work from about here with pressure. Push down. Lift the ankle. Just the ankle comes up. And then back down. And then lift a little off of the ball. Come back down for pressure. And lift the ankle again. Good. Relax. Lift the knee a little bit. Come back down. Lift the ankle. Try some of these. And then go back to leg extension. See how that feels. Okay. Find a spot. So we're going to go from here to like right about there. And that will be it for the upper leg. So we're sinking in right there. Again, move from your hip, push down into the ball, as much pressure as you can take. And then we're slowly straightening the leg. And then bring it back into a bend. Try a few of these, see how you like it. Good. And then from there, we're going to try the ankle. Lifting, down. Lift off the ball a little, pressure relief, back down. And then we lift, and down. Good. Let's do one more. Lift, and down, and come off the ball at that point. Good. So let's set up for coming into the lower leg in the front. So for that one, just to review, this is the tibialis, right here, the tibia. This is the bone, the big bone in the front of the lower leg, the tibia bone. So the anterior tib, we're going to line up right about here, and we're going to run down, okay, towards the foot. Then we're going to get into the peroneus, which you feel the antib here, and then it drops into a little bit of a subtle groove right about there, and then we have the peroneus right there. And we're going to run down that for as long as we can. Okay. And then we'll find that post-tib over here. We find the groove of the bone right here, so we want to get right in as the groove comes in and dents in. We want to find the ball right there. And then we're going to slowly make our way down the leg that way. Okay? So for this one, let's start laterally on the leg. So we're going to find ourselves sitting like this. That's kind of the best way to go about it. And we're going to find that antib first. So right below the knee, right about here. Okay? And we're going to lower the leg to the floor. So we're holding the ball. Since we're kind of in the front and we're lateral at the same time, we might need a little assistance holding this ball in place, keeping it there. So let's place the hand right there. So the same arm that you're on with the leg that's bent that you're putting the pressure on, this is our downward pressure arm. So this arm is going to go right here. And we're going to lean our upper body weight into the arm, downward into the leg. Stacked shoulder, downward pressure. Okay? So this hand can stay here if you need a little help holding the ball in place. And then we're going to pull the toes back. Good, and then point. You'll feel it. Point, pull the toes back, and point. Now let's try to get a little horseshoe movement. So we hook, and we scoop and hook the other way. So we're hooking up, like lifting the big toe, hook, lift, squeeze, scoop, and go the other direction. Okay, so we feel that antib firing as we pull the foot back into dorsiflexion, creating contraction up that anterior leg. Okay. Coming through. So we're not really gliding much here. We're going to just scooch the ball down, find pressure again, downward, and then we try that again. Good, extend out through the heel, and then point the toe. Good. We want to keep solid. Remember our shoulders, our yoga shoulders, we're not here, we're here. Lots of space right here. It gives us more bang for the buck. Lets our body stay in this alignment without fatiguing. Good. Try a little horseshoe, see how that goes. So we just we draw a U with our foot. That's all we're doing here. This bottom side's going to be a little bit flatter, clearly, the floor's in the way, but the intention is there. We pull the foot back, we flex, we squeeze, we feel it right here. Good, and we feel it right there. Okay, so let's make our way down just a little farther. And it's going to get a little bit more intense as we make our way down, just so you are aware of that. Elbow pressing, find that pressure, lean downward into your leg, and try it again. Point, good, and flex. Good. A couple of these. And remember, we relax, right? So a couple of these, lift off the pressure, move the ball, try it again. As we get a little bit lower, you see my foot is floating off of the ground. So as we make our way down, we have more room to accentuate that horseshoe movement here. We're just getting way more contraction into the muscle. Okay. So making your way down all the way. I'm going to move on so we're not here for too much longer. Peroneus here. So we're getting in again. Lower leg right around here. And we're going to make our way down. So I'm just going to do a few of these right here. Very tender. You drop in right below the knee. We're very lateral with this one. Downward pressure. Find that spot. Flex and point. Same thing, same movement as before. So we just take our time. We make our way down the leg in the same way. As we come down halfway-ish, we can see that our foot will pop up off the floor, and then we have more mobility in the ankle to create that flexion. Good. And get in there a little bit deeper. Okay. So the inside of the leg, which to me is the hardest spot in the whole body to get to on your own. So we feel the bone right here. We're going to do our best to get this spot and see how we do with pressure sensations and if it feels deep enough. Okay. So we're going to get in right in here. We're coming down and we're going to ride down the bone all the way down to about here. Okay. So for this one, we're turning so we can get the inside of the leg down on the ground. Okay? So we're coming down again onto our elbow, are lifted up and out of our shoulder here, good alignment, and we're going to place the ball right inside the leg. So we find the bone, we drop in, right in the groove. Good. So here, we're applying downward pressure. You can use your hand to push in a little bit more, but you may not need that. You may be fine right here and feel plenty. Okay. Start to roll down a smidge till you feel that lovely burny sensation there in the leg. And then we're going to flex and point. Good. Try some horseshoes the best you can. Good. Make your way down. A little bit farther. When your foot pops up, you can start a little bit deeper. You can begin that deeper horseshoe movement, where you pull the top of the foot back a little bit more to create more sensation there in the muscle. Don't forget about that break in between where we take that moment, we lift, we sink back down, right? Making our way down the leg. Find the spot. So when you get midway down the leg, you have enough movement in your body here where you can roll if you would like. It's a little bit easier here on the inside of the leg to roll with pressure, pushing straight down into the ball as you press out all the way up and all the way down. So like I said in the beginning when we were talking about the anatomy, this part here can be very tender. Do you see where my ball is? Right about there. You see? That spot can be really fiery for you. So I would recommend staying there and putting more pressure on it, rocking it out a little bit, you know, giving it a little bit of attention, seeing if you can work out that fieriness and make it feel a little bit better for you. We bring the leg in, we roll it out, right? Good. So I'm putting these two videos, this one as well as the posterior lower leg one, I'm putting those two on my August wellness newsletter. So plan on watching those if you are interested in this kind of work with the deep pressure. I will be adding on back and upper body and shoulders here down the road. So if you are not already subscribed to my YouTube channel, it would be great to go on the YouTube and subscribe at Om Shanti Healing and just keep an eye out for the upper body component. I will guide you through getting into all the shoulder girdle muscles. We will work pectorals. We will get the painful subscapularis. We will get the painful teres and insertion points here for several of the muscles right in the back of the upper arm here, where we hold a lot of tension, especially if you're practicing yoga on a regular basis. Those chaturanga arms can get really sore and fatigued. So we will work deep into all those tissues around the shoulder to find some real relief. It is quite amazing once you find those spots that are so sore on your body that you didn't know were there, or maybe you did know they were there, but you don't know how to relieve the pressure, relieve the tension and the pain that's in those spots. I can show you how to do that. So stay tuned on my YouTube channel for that video coming up here shortly. Enjoy the lower body one in the meantime. Contact me with any questions, or if you have requests for videos, at Higher Vibes for You, that's the number 4 and the letter U, at omshantihealing.com. So thank you so much for watching my video. I hope it helps you a great deal, improve on your comfort level. Thank you so much for watching. Namaste.